Good afternoon. My name is Brandon Tucker, and I have the pleasure of serving as the campaign chair for our upcoming campaign. I want to welcome you to today's community town hall focused on poverty, racism, and trauma. There's no question that we're seeing these issues on our TV screen. We're seeing them online, but they're happening right here in our local community. As we kick off our campaign this year, we want to focus on the issues that our community need to address the most. And today's conversation will jumpstart what will be a future investment by way of programs and services the United Way continues to support because of the financial contributions and the community support that we get each year. It is our goal that by 2030, that Washtenaw County will be a community where your zip code does not predict your opportunity in life. Today's conversation helps us achieve that goal. I want to thank you for taking time out of your day to be with us, for your continued support of your United Way. And if you're part of a workplace campaign or happen to be an individual contributor, we thank you because every dollar allows us to achieve that vision. With that, I want to now welcome our president and CEO, Pam Smith.
Thanks, Brandon. Hello, and welcome to the Community Town Hall, where we'll explore the effects of poverty, racism, and trauma in our community. I appreciate you joining us in the fight to create a thriving community for everyone. Many of you may have participated in one of our equity challenges. We brought more than 10,000 people together in Washtenaw County alone. I'm proud to share something that we pioneered in Washtenaw County has now been completed by more than 60 other United Ways nationally and 2 countries abroad. That brought more than 100,000 voices into this conversation to dismantle the racial inequities that persist. Way to go, Washtenaw, and thank you for giving us the courage and the momentum to take the next steps, specifically addressing poverty, racism, and trauma. Our equity work established us as trusted partners, and when COVID hit, we were able to quickly galvanize our community and raise the funds needed to help the people most in need. Our hyper-focused investments were directed at communities most disproportionately impacted, and we expect to take those strategies into 2022 and beyond. There are exceptional leaders in Washtenaw County that you'll get to hear from today, and I challenge you to be a leader in your own right. Take this information and what you learned in the challenges and put it to work building your equity muscle to create community change. Through our years of work engaging, building, and uniting, we have found that the solution to the problems of disparities lay at the intersection of actualizing the power of equity and being inclusive in co-creating strategies that address community challenges with members of our beloved community. Let's get started. Today, we see you, Washtenaw, and appreciate your participation and look forward to building a more equitable tomorrow. And now, over to you, Rich.
Hello, everyone. Welcome and thank you for joining this Community Town Hall. I'm Richard Chang, CEO of New Foundry, and I'm privileged and honored to be the current chair of the United Way of Washtenaw County. The mission of the United Way of Washtenaw County is connecting people, resources, and organizations together to create a thriving community for everyone. The vision of the United Way of Washtenaw County is that by 2030, we have an equitable community where opportunity is not limited and every member reaches their full potential. What does this mean? One zip code no longer predicts their opportunity in life. Life expectancy is the same across all populations and communities in our county. The academic achievement gap is eliminated. Poverty is not generational. Everyone is able to thrive and meet their needs: housing, food, transportation, education, health expenses, and childcare. As a member of the private sector, it is my hope that other private sector members will join me in working with the public sector to achieve those outcomes. This starts with equity. Equity is the foundation of the United Way of Washtenaw community's work. Equity is also the foundation of true community. Or, said another way, true community is equity. Everyone who wants to succeed is supported and can, from individuals to companies large and small. This leads to community resiliency, which is the result of a workforce pipeline built from community. To get there, though, we must continue to peel back the layers as to why we have pipeline issues. These layers include the academic achievement gap, historical and systemic conditions and policies such as the GI Bill, redlining, and housing covenants, lack of inclusion, intersection of identities, marginalized people and populations, and of course, diversity and equity challenges. First step is awareness on how poverty, racism, trauma are root causes of what we are seeing in the community. The second step is understanding the reach and impact of equity. It affects work, home, and community. The third step is be involved. The United Way of Washtenaw County is exploring the ways in which it might continue to create gathering spaces for people to grapple with race, identity, and privilege to create more equitable environments for us to live, work, and play in Washtenaw County. This work is the cornerstone of our agency. We want to help build our community's awareness of the ways that bias, prejudice, privilege, and oppression show up in our work and lives. Crave awareness, volunteer, give, advocate, affect, and effect change, be the solution. It is my great pleasure to introduce to you our past chair, Yodit Mesfin-Johnson, whose thought leadership elevated and expanded the equity work at United Way of Washtenaw County. Thank you so much for your time. Yodit?
Thanks, Rich. I'm incredibly grateful to have the opportunity to continue to steward United Way's mission and vision alongside you and our esteemed colleagues. You know, when we cast the vision as a team that by 2030, our zip code wouldn't define our quality of life, we knew then that it would take all of us, not just some, to transform the conditions that left poor folk and queer folk and Black, Indigenous, and Brown folk locked out of opportunity to thrive alongside others of us. Poverty, racism, and trauma are principal threats to United Way's mission and vision. You know, I recently heard a story that I feel illustrates this well. It's a story of two people sitting at a riverbank, chatting and fishing. And one of the people looked across the river and suddenly saw a beautiful child nearly drowning. And of course, they both jump in and carry the child, grab them and carry them to the bank. No sooner than they get that first baby out, there's another, and they do the same. And there's another, and they do the same, and another. They worked furiously, tirelessly together, swimming across the river, grabbing the child and getting them safely to the riverbank. And suddenly, one of them, as the children continued to flow down the river stream, said, "I'll be back." And the other person says, "Well, where are you going?" And they say, "I'm going to find out who keeps putting these kids in the water." We've spent years pulling kids out of the water. And now it's time that we move upstream, that we examine the root causes of why poverty, racism, trauma, houselessness, food insecurity, a lack of quality education or resources, and so many other seemingly intractable issues persist in our community, despite the opportunities that we have to transform them. Housing is a human right. Food is as well, quality education and childcare. And so it's not just our deeds or our investments that have to change. Our will to transform these conditions needs to change too. We have been swimming in the waters of dominance, of extraction, of exploitation, of white supremacy. And now, more than ever before, do we have an opportunity to embrace mutuality and collective care, love and justice, propelled by the work of United Way and so many others in our community. We can come together, private and public sector, through our shared commitment to a community where our zip code no longer defines our quality of life. The invitation is there, And today we have an opportunity to hear stories and explore the root causes of racism, poverty, and trauma here in our community, and then to learn collectively how to be part of the solution. I hope you'll continue investing in the good work of this organization, and importantly, that we'll continue to challenge those thoughts and the will to transform the future together. And with that, folks, I'm Yodit Mesvin-Johnson, Ypsilanti resident and president and CEO of New Nonprofit Enterprise at Work. And I'm delighted for you to hear next from our speakers and storytellers, who include Derek Jackson of the Washtenaw County Sheriff's Department, Morgan Boydston of the Office of Community and Economic Development, and Matthew Countryman, Associate Professor of Afro-American and African Studies, American Culture and History at the University of Michigan. Matthew is also chair of the Department of Afro-American and African Studies. You are in for a treat, folks.
Thank you, Yodit, for those amazing introductions. Thank you for the work that you do at New. My name is Crystal Campbell. I'm the Program and Communication Manager for the Washtenaw County Racial Equity Office, and I'll be serving as your moderator. On our panel today, we have Morgan Boydston, who's a Human Service Manager with the Office of Community and Economic Development. We have Derek Jackson, who is the Director of Community Engagement for the Washtenaw County Sheriff's Office. And we have Dr. Matthew Countryman, who is a professor of history at the University of Michigan. If you're interested in learning more about any of our panelists, please feel free to click the link to access their bios. So I'm excited. We're going to jump right in. Our first question is for Morgan. We know today that we're talking about racism and poverty and trauma. So Morgan, can you talk to us a bit about the state of poverty here in Washtenaw County?
Sure, yes. So what we know for sure is that Highway 23 has a distinct line and difference in lived experience. And that line draws the difference of how one might experience healthcare access, how they might experience job opportunities, educational access. And so that creates a huge economic disparity for many of our residents that live in Washtenaw County. And so as you can imagine, that would mean that there's a lot of communities and a lot of folks who have no idea of the poverty that folks are facing, think that everything is great, that everyone has access to the same opportunities, and therefore there's something wrong with them for not being able to accomplish the things that they have accomplished. It's the reasons why we can't, for whatever reason, have great affordable housing options, because community votes away those options when we have them on the table, right? It's the reason why certain school districts are advocated on behalf of and get increased funding for their students while others don't. So there is a huge disparate difference in the way people experience life in Washtenaw County that is directly impacting their economic standing. And that, as we know, impacts every other aspect of one's experience to racism, right? That racism is the one area that sometimes greenery is the thing that can help you get by. But if you don't have access to that same economic opportunity, you can't even bypass that. We talk about, again, educational disparities. And again, if you're not educated, you can't have access to job employment. So the list goes on and on and on. And unless we do something about that, unless we change the experiences that folks, that disparate experience, we're going to continue to go in a cycle.
Right. Thank you. Thank you for that. And we'll have the opportunity to drill down a little deeper into how folks are impacted by poverty here in Washtenaw County in just a few minutes. But next, I want to talk to Derek Jackson. Derek, can you talk to us a little bit about the impact of trauma? What's the state of trauma in Washtenaw County right now?
Yeah, thank you, Crystal. I think similar to what Morgan just said about that divide, and if you're not really connected to it, it doesn't seem real, and you may blame other folks for those circumstances. Trauma in our community, in Washtenaw County, you think about all the great things there are in Washtenaw, one of the most educated communities, counties in the state. Our economic development and job opportunities and housing market are one of the best in the state. But when you look at trauma or the impact of violence, as I look at it from my role here at the Sheriff's Office, it can be pretty significant based on where you live at. And again, you could be 6 miles down the road and not personally feel that impact, but in some of our communities, it's pretty significant. I have some men that I work with out of the city of Detroit, and one day they said to me, Derek, the disease of violence and trauma in Washtenaw County is it's so deep in Washtenaw County as compared to Detroit. And I just said, well, what do you mean by that? Right? It kind of caught me a little bit off. And as they described it, they said, well, because you're so geographically small in your county and you can't really get away in your county, and the family structures are so interrelated in your area that when violence or trauma happens to one family, there's these ripple effects and waves that go across your entire community. And sometimes those waves can be generationally impacted, meaning it might happen to me, but a generation behind me really still feels the impact and the level of that violence. I'll give you a couple of examples where a young person witnesses and is a part of violence, not because they themselves are in any kind of trouble or anything like that, but they see something in their community and they see it happen to someone that they deeply care about. How that impacts that young person and impacts their world, and then somebody else that wasn't even at that particular situation, but just happens to know who that person was that trauma happened to, they feel just as impacted as the person who was there and viewed it. And so I think when you think about the state of trauma, we sometimes wipe it away as if it didn't happen to me, but there's so many interconnected families and community members here in Washtenaw that one incident has a really big impact on our entire county.
I appreciate that. And I appreciate your adding context and giving us real life examples of what this trauma and how this trauma is impacting residents here in the county. And we'll get more into that later in our conversation today. But next, I want to go to Dr. Matthew Countryman. Dr. Countryman, can you talk to us a bit about the state of racism here in Washtenaw County?
Thank you so much. I'm happy to. And thanks both to all of the panelists as well for this conversation and for giving me the opportunity to join in. So I would say two things that I think very much parallel what our previous panelists, Morgan and Derek, have said. One, though, is that we can't think of this solely as a county question, right? Just as Derek has pointed us to Detroit, we need to think about racism as a national question, a national issue, a part of our history as a country. And Washtenaw County is not exempt from that history or from the present versions of that. And so we shouldn't be surprised that racism is a crisis in our county. It is a crisis in our nation, has been historically, and there's no reason to think it would be different. But the second thing is that this issue of the dividing lines is crucial to understanding racism. And again, I think we have educated or thought we want to think of ourselves as a colorblind society, and therefore, when we find that there are Black people who are doing well or thriving or in different parts of the county, in other words, when there isn't a single line between white and Black, as we imagine segregation in the past in the South was like, that racism therefore is not there, it has gone away. But in fact, if we look at all of these characteristics, right, we see that there's a racially disparate aspect to them, whether it's poverty, whether it's violence and trauma, whether it's denied opportunity, whether it's literally in the built environment where you live, where populations concentrate, and that is because of a history, but also because of a present of racial inequity that is built into our institutions, that is built into our sense of what the norm is, and so we're not concerned if there are differences in educational outcome between school districts that are racially disparate from each other. That's somehow it's in fact racism to think of that as, well, that's just the way things are, or that's because of that community doesn't have the assets or the commitments or the capacities it's supposed to, rather than seeing that as in fact a function of racial racism, of racial inequities in our county and in our society. So the state of racism in Washtenaw County is the state of racism in the United States. And it is expressed in the inequities, the inequalities, the distances that we see. And of course, and I'll just close by just pointing out, COVID has pulled the blinders back on that, right? It has, and we can see that, therefore, that the differences in housing, differences in educational opportunity, differences in employment, differences in experience of the healthcare system and treatment within the healthcare system have created differences in disease and death in our very community over the past year and a half.
Thank you. Thank you for that, Matthew. So we've heard from Morgan and Derek and Matthew about the states of poverty, trauma, and racism here in Washtenaw County. We understand that these conditions do not exist in a vacuum, that there are ripple effects from racism that are reflected in the trauma and the poverty that we experience, and that is larger than Washtenaw County. So I'm glad that we're here to talk about what we can do and how we can impact our county that will then in part impact the condition of our country. So Derek, you've already kind of started doing this for us, but can you share with us some examples of how trauma shows up in our community and what we need to do to address it? How is trauma holding back opportunity in Washtenaw County?
Yeah, I think whether you look at trauma, racism, or poverty, because they're all interrelated, what you wind up seeing is, again, not only just generational impacts, but the idea of the notion that it has these larger systemic impacts in ways that we may not visibly see right away. So when I think about trauma and some of the things that are happening in communities, let's look at in Washtenaw County, African Americans in particular, I've seen where have a 10-year less life expectancy than their white counterparts. That is significant. It's not only about violence in Black communities, right? Don't hear me wrong. It's about all those other things around stressful environments, around the lack of affordable healthcare, around the lack of sustainable employment and education, and all those kinds of things that I think in Washtenaw County, we see those huge gaps. The other thing I'll talk about is I always ask the question of why. So why is it in a community like Washtenaw County, we see that discrepancy? Why is it that we have, with all these resources, one of the higher recidivism rates in our county compared to our local community county partners, who are like our neighbor county partners? So when you start to ask yourself what makes us unique, you really start to think about the gaps between the haves and the have-nots in all these areas, race, poverty, and trauma. And so I think one of the things that starts to hold us back is when we don't recognize the state of trauma in our county, we don't address it appropriately. But also, let's just look at the implications of what a young person has to deal with that trauma today, what it looks like tomorrow, and how that might impact that family, that neighborhood, and then our larger community.
Thank you for that. Morgan, we'll ask you the same question, looking at it through the lens of poverty. Can you show some examples of how it shows up in our community, how we need to address it, and how is poverty holding back our access to opportunity in Washtenaw?
Yeah, so first, I just want to lay the record straight that poverty doesn't only affect those that are in poverty, right? So when you have a highly segregated area as we are, and as of 2017, we are the seventh economically segregated community. What that means is that everyone is less likely to have opportunity. Some folks, again, still have access to things more than others, but if we all aren't doing well, then we all aren't doing well. And so what that means is you have, for instance, a homelessness list that's directly connected to the fact that folks can't get affordable housing or can't sustain the housing that they're in because they're underemployed or don't have job access. That means you have 300 people, over 300 people annually who are literally homeless with no place to go. What that means is that you have a family homelessness that's predominantly Black female-led households with children that disproportionately represent the population of the Washtenaw County. So what we see is disparate rates of lack of access, of oppression, of opportunity across the board that don't just affect those that we stereotypically would assume would be in that space. But it means that you're also in a classroom with young people who, when they go home, they don't have the resources in order to really be educated and be productive in class due to trauma, due to racism, due to poverty. So if you're in a household and with that same child, that means that your child is also having to experience whatever may come out that day, right? So if we don't acknowledge that some people have it differently, that some people are affected differently, and some people don't have access to it, we are all at the whim of that. And there's only so much you can segregate yourself from that, because then you get to crime rates, right? Then you get that spillover into your community of folks forced to have to take what they don't have and what you refuse to give. So it affects us all. It's just that we are able to, for the most part, separate ourselves from it when it works best for us to.
Interesting, and thank you for that. And now we'll go to Dr. Countryman. Dr. Countryman, same question to you. Can you talk to us through the lens of racism to tell us exactly give some examples about how it's impacting us in Washtenaw County and how it is blocking our access to opportunities?
So thanks for this question. In some ways, both Derek and Morgan have already pointed in a direction, right? Because everything they've described is, of course, disproportionately impacting people of color in our county. And we see that, again, as I referenced earlier, in the impact of COVID, we see that in the impact of the carceral state of imprisonment. We see that in our education system, both the differences between school districts that have more students who of both low income and people of color, but also within school systems in differential educational outcomes, as in here in Ann Arbor. But I want to point into an additional direction, which has to do with the way in which our institutions actually work, right? So it's not simply that the outcomes are racially disparate, but that people's experience of institutions, be they schools, be they criminal justice institutions, be they nonprofit organizations, means that when your experience tells you that these institutions that are outside your community, that are controlled, that are run by folks from outside your community, even if they're well-intentioned, are not responsive, don't understand, or aren't addressing the sort of essential inequities that are part of the experience of your daily life, then you aren't able to take advantage of what those institutions have to offer. You aren't trusting of those institutions. And so it's not simply outcomes, right? It is the day-to-day cultural life, institutional life of our community that's shaped by this landscape of racial inequality that we all have to live with, and that reinforces and reproduces that landscape, right? So the child who is in the school, if the school expects the child to have to do less well, or sees the child as lacking what they need to succeed, then the child, of course, understands and learns that, very, very clearly. They may not at first understand that race is a part of that. They just know it's their experience, but eventually they understand that it's an experience they share with other children of color, and that's the other aspect of racism that we have to grapple with, right? Which is that it is a part of daily life and the way our communities interact with each other, and none of us can escape it. Right? None of us are free from it because it is, it is built in the very institutions, in the very air we breathe.
Thank you. Thank you for that, Dr. Countryman. I think you did a good job of summarizing and wrapping up and adding to what Derek and Morgan shared with us. So what we heard that from Morgan, Derek, and yourself is what is holding us back as it relates to racism, poverty, and trauma. It's not recognizing or acknowledging the impact, that there are long-term impacts to all three aspects, that it affects all of us, not just those of us who are most directly impacted, and that the experiential nature of institutions leads to a distrust, and that these systems, these ways of living, this culture is reproduced, is reinforced by the distrust, by the trauma that's induced, by the poverty that's experienced, and it relates to all of us. Thank you so much. So for this next question, if Morgan could answer first, how do poverty, racism, and trauma interact and intersect as active forces that oppress opportunities for individuals in our community?
That is such a great question, and I'm going to try to be as succinct as possible. So what we know is that if I started with racism, what we know is that racism is one's inability to access certain social constructs. It stereotypes folks into a bracket. It also systemic, right? In that policies are created to intentionally hold a group of folks back. And so that's traumatizing, to see everyone around you being able to excel in a way that you cannot, despite how hard you try, despite how hard you succeed, to see someone else maybe less qualified than you, maybe less capable than you, less smart, less athletic, less et cetera, get by just because they look differently is traumatizing. It creates mental health issues. It creates physical health issues. And this is all documented. We know this, right? And so the result of that is then you're not given, again, access to opportunities because of racism. And so then you might not have the same educational access, which limits your ability to have a successful job or a job that gets you the same amount of money as someone else who might have been doing that same field. Or you might have the same job as someone, but you get paid differently because we still have a pay wage disparity in this country. So that's intertwined. Then we think about poverty in regards to racism, and that there's been literally redlining happening in our community and nationwide, where folks didn't have access to housing and ownership of that housing, which prevents generational wealth, while some others did get generational wealth, which puts you into communities where there's high crime, where there's less access, where there's less business opportunities, where there's less what am I saying? Yeah, I guess business opportunities is the best way. So we're perpetually in a cycle of creating and preventing opportunities for some and creating trauma and oppression for others. So they are very much integrated and entwined. And it's actually really hard to even answer these questions without talking about the other two.
Thank you for that. Derek, same question. Intersectional nature of race, racism, trauma, and poverty.
Yeah, I was going to mention it very similar to what Morgan said, the trauma of racism. And I'll just give one small example. A group of kids I used to work with from one part of our community were going into another school district. And I remember the one thing that really resonated with them when they came out of giving the presentation in the school, someone just said, man, they got a whole classroom full of these new computers, and it really stood out to them, and they compared it naturally to their school. And he was sad about it. He was literally visibly shook by it. And so when you think about the differences between the have and the have-nots, and that trauma in response to the racism, or I talk about this personally, walking into a store, and I know for many people, it's hard to comprehend what it's like to walk into the store. I'm a grown man who works at the sheriff's office that makes good money, and I go into the store, and to see the security person that I know is a security, even if he's not dressed in a security uniform, follow me through the store. That still happens to this day. Now, I know how to handle it, but it still does something to the psyche of a person that I can't just be in my Black skin to go into your business to spend the money that I've earned in a legitimate way, but not be looked at. And again, simply, I don't know any other way to describe it, simply based on the color of my skin. That does something to a person. I guarantee it does something to a young person to kind of grow up in that environment, to see that huge gap between the haves and the have-nots. But I'll also talk about it from a poverty standpoint. So it's no wonder, and when you look in Washtenaw County, people talk about, we don't call it boroughs, but we have these very clear boundary lines across neighborhoods. When you look at some of our more economically challenged areas, it aligns with some of our Blacker and browner communities. why Washtenaw County is that the case. It isn't because Black and brown spaces in and of themselves are inherently wrong or do something wrong. It's because the resources leave those communities. And we should be asking ourselves the question of why is that, right? Why are there these food deserts in certain parts of the community? Why is it harder to get transportation out of certain parts of the community that just happen to be darker in skin color with less economic opportunities? And then the last one I'll throw out there is just the impact that this has not only on economic development, but on just health in general. I mentioned a 10-year discrepancy between Black Washtenaw County residents and white around life expectancy. Well, if you're more likely in a poor neighborhood that's predominantly Black or brown, live closer to those environmentally unfriendly places, so the rate of asthma and some of those things are a little bit higher. Again, that's happening in a place like Washtenaw County. And the only question I can throw out there is why? All things being equal, what I see is a racial and an economic difference. And you put all that together and it really ties in with a traumatic response.
Thank you, Derek. Thank you. And Dr. Countryman, the same question we posed to you. Can you talk a little bit about the impact of the intersectional nature of racism, trauma, and poverty as you understand it?
So I actually don't have a whole lot to add to what Morgan and Derek have said. They really have answered this question, I think, quite comprehensively and brilliantly. What I would point out is that it's not surprising that we're in this situation. There's a long history in our county to the factors that that we see every day, right? To the outcomes we see today. And in fact, I'm currently working with a research team of U of M faculty and students, as well as community partners, including UD, who you heard from sooner as part of our research team, looking at this history in our county and looking at the connection between a history in which there were very explicit, very unapologetic efforts to make sure that there were racial divisions and that people were and that there were locations where people belonged and didn't belong in our county. Racial covenants, Morgan talked about redlining, all of these things which were at play from the very beginnings of the 20th century. And then how does that get reproduced when in fact those things become illegal in the 1960s, right? When we have bans on housing discrimination, we have bans on employment discrimination, on educational discrimination, and yet we continue to have the same sets of outcomes. And this is where we need to look very closely at our institutional practices, the very institutional practices that Derek is pointing out when we talk about where not only access to resources, but where environmental pollutants are located and those kinds of things. And we need to understand that in part, this is rooted in a kind of cultural understanding that the best place to be is whether it's in a neighborhood or an institution is one that is primarily white or entirely white. And that if you were in an institution or a community where that's not true, then there's something wrong, right? That's where the institutions are wrong. And this is not a lesson that's just learned by our communities of color, our children of color. It's learned by the white majority population too. Where do you want your child to be after school? Where do you want them to be during school? What kinds of school do they want to be? What happens if the school begins to change and it has an increasing percentage of students of color? What happens, downtown if there are in downtown Ann Arbor, if there are kids congregating at the bus stop because they've been to the neutral zone? Is that a problem? Why is that? Why do we assume that's the problem? And so these practices, and this is the challenge of understanding them, is they are both deeply historical, and yet they are also deeply part of our everyday life and the norms that we don't really question because they are simply, that's the way things are. And too often we think that's the way they should be because those people, those communities are less capable. They have their cultural values aren't right, or we somehow essentially trying to blame those who are losing out rather than look at ourselves, look at our community in the way it's been organized, as I say, for more than 100 years. I mean, it is not surprising that that things like COVID have happened the way they did in this county, because that's the way things have been and have continued to be for over 100 years.
Certainly, certainly. Thank you, Dr. Countryman. So what we heard is that the impact of racism leads to trauma, that trauma exasperates and creates poverty, that Washtenaw County specifically, the country as a whole, has a long history, so that we should not be surprised that we're living in the conditions that we're living in now. And that culturally we've learned to, and every day live in a space where we duplicate and replicate these norms of othering, of assuming that whiter is better, automatically assumes that whiter is better. And so this is why the work of the United Way and the work of all of the community partners here are so important. So it sounds like the policy work is necessary to undo some of the historical mechanisms that are in place that perpetuate these things. And the culture change is necessary to change the norms and the way that we think and behave in our everyday lives. Thank you again for your answer to that question, Dr. Benjamin. From your perspective, Derek, how can the United Way of Washtenaw County best address these issues?
I think today's conversation is a great example of bringing people together, educating folks, challenging ideas, and just having the discussion. Again, we live in a great community. I raised my family here. I love it in Washtenaw County. But with all those good things, we need to be able to reflect on how we can become a better community. I think the other thing is invest, because we're talking about United Way, investing dollars into certain efforts. Invest in those things that are effective. Oftentimes we in Washtenaw County, we're very educated. We like to think about those things that sound really good, but I think effective in moving the needle for me is a big priority. If it's not moving the needle, that means our young people and our families are still suffering tomorrow, even though it felt good what we did today. So finding what's effective, even if it's not labeled a best practice. And then the other part, and this is just again something that I've been really trying to think about, is how do I direct my resources to the people who are really connected to the individuals in the community to make the biggest impact. And so to me, I think those are just three direct ways they can have a impact.
Thank you for that. Morgan, same question to you from your perspective. How can the United Way of Washtenaw County best address these issues?
I say be bold. Be bold in the way that you talk about this. Don't shy behind what's politically correct or what you think people can take or want to hear. Say it and say it straight and plain. Fund boldly, fund initiatives that someone else might have turned away because it didn't have that best practice, as Derek mentioned, or because it seems so outlandish that how could it work? Maybe that's why it will, because it's something that we haven't thought about or tried before. Be bold in the way you seek donations. We already know that especially people of color give way more per capita than any other population, yet we stop trying to outreach to those populations. Why? Be bold. Don't stereotype them just because you think they're poor. That means they can't give. Be bold in the recruitment you have in your boards and your committees and your staff. That's how you get change happening, is when you have innovation and new people doing the work with you.
Thank you. Thank you for that. And lastly, Dr. Countryman, can you answer this same question? How can the United Way of Washtenaw County best address these issues?
Yeah, I think like I'm saying the same thing over again in my start, but I'm so aware that Derek and Morgan have said so much of what needs to be said. And so I would just highlight much of what they said. I would only add that I think we should be put it this way, we tend to evaluate people's on their intentions, but particularly when it comes to race, and to think that the problem people are people with the bad intentions. With race, in some ways, intentions is irrelevant to the question. The question is, are you being bold? As Morgan said, are you committed to make it to a change agenda? Are you, and as Derek said, are you doing things that will actually change things, not just make ourselves feel good or feel like, well, we tried our best, or we were fair, right? A lot of fairness, this is simply about the status quo, by keeping things the way they are. We need to focus on what will actually change our institutions, will change our outcomes. And to do that, I think we need both an inclusion agenda. In other words, as Morgan suggested, we have to have new people at the table. We can't simply, and that you have to be willing to listen to a broad range of voices, and you need to value those differences of experience and perspective, including those who are perhaps bitter, cynical, whose life experience tells them not to expect much good from folks. They can be very different. Those folks, all of us, have a moment like that. But so I don't mean to make that specific to certain people, but it's never easy to deal with people who are rightly skeptical, right? That is a challenge. But those are the people who need to be at the table. Those are the communities that need to be represented. And we need to have a commitment to real change. Again, not simply to a kind of feel good doing, stuff that affirms our goodness, our best intentions. And that, again, this is a long history in our society of, whether it's Northerners or liberals or people in cities sort of saying, well, we're not as bad as them, so you shouldn't give us a hard time. And that should not be the standard. The standard has to be, what's changed? What are you really making different? And it's really not, it's irrelevant what your intentions are, bad or good. The question is, what are you delivering in terms of change?
Right. Thank you so much, Dr. Countryman. So we heard from Derek and from Morgan and from Matthew is that in order for the United Way to address these issues, we have to be innovative. We have to be committed to outcomes that really impact change. We have to be non-performative. We have to be non-performative in our authenticity. We have to value differences of opinion and experience. And we need to have an inclusive agenda. That's what I heard from the three of our panelists as it relates to how the United Way can push forward and make change in addressing poverty and trauma and racism here in Washtenaw County. We thank all three of our panelists today for joining us and lending your expertise and your voices and your ideas. And at this time, we're going to hand it off to Gregory Dill. Gregory Dill is the administrator for Washtenaw County, and he serves as the vice chair of the board for the United Way of Washtenaw County. Thank you for your time, and we'll pass it off to Greg.
Thanks, Chris. Thank you for joining us today. As the current vice chair of the board and county administrator, I am invested in our community's future. We want Washtenaw County to be a community where all residents have the opportunity to thrive. Neither race nor place should determine your opportunities in life. Fortunately, we have the power to change those patterns and ensure a more equitable future with fair and just outcomes for all Washtenaw County residents. It's important to consider the unique needs of rural and suburban areas when providing resources and programming to families who live outside Washtenaw County's urban core. Our work will require focus and long-term commitment to undo the past systemic and institutional racist practices. This work to address racism, poverty, and trauma will require all of us. Washtenaw County's partnership with the United Way is one way to align our efforts, develop strategies, and make our work more impactful. In today's conversation, we heard from 3 local experts, and we heard from you via chat, and we want to hear more. Please reach out to our CEO, Pam Smith, to share your ideas and learn how to be part of our community solution. Our agenda for change begins with you. Thank you for living united.